Type 1 spinal muscular atrophy is a recessive genetic condition, and their common symptoms include developmental delays and most children not being able to support their head and sit up unassisted. Many of them have trouble swallowing and breathing, and this can cause them to choke and gag. This disease is evident at birth or within the first few months of life. Type 1 spinal muscular atrophy is a genetic condition, and the life expectancy for an infant diagnosed is only about 1 to 2 years. And there's also no specific geographical region that puts people at a higher risk for SMP type 1. If both parents are carriers for the gene, then there is a 25% chance that the child will inherit the gene and inherit the disease. Another recessive genetic condition is albinism. These effects include white or pink hair, skin, and iris color. These are the most drastic effects of albinism. And people with albinism also have vision problems. This causes them to cross their eyes, they have light sensitivity, and they have rapid eye movements. There's a specific type of albinism that only affects the eyes, and their hair and skin are normal. This disease can also cause patches of skin to be missing on people. Albinism appears at birth, and now with genetic testing, it can also be detected before birth, and this is a genetic condition. People who have albinism are expected to have a normal life expectancy, and the geographic location does not matter when inheriting albinism. And here to the side, you can see a picture of parents who are albino and parents who are carriers for the gene. Here's a link to a video that ABC did about people who have albinism, and you can see some of their struggles in their daily life. Another recessive genetic condition is phenylketonuria, and this disease increases the levels of phenylalanine in the blood. This can cause intellectual disabilities, seizures, delayed development, behavioral problems, and psychiatric disorders. This can be treated and has different levels of severity. Children with a mild form have eczema and light hair and skin. This can appear after the first few months of an infant's life and is a genetic condition. People affected by this disease have a normal life expectancy, and the chance of inheriting this disease is greater in Ireland and Western Scotland. Achondroplasia is a dominant genetic condition, and its effects are a short stature. That's the most prevalent and obvious. People diagnosed with achondroplasia have a normal-sized trunk, short arms and legs, short upper arms and thighs, and a limited range of motion at the elbows, and they have a larger head with a very prominent forehead. This condition appears at birth, and it is genetic. If the disease is normal, then the individual should have a normal life expectancy. Geographical location is unimportant in inheriting the gene for achondroplasia. And if two parents that have achondroplasia have a child, there is a 25% chance that the child will be completely normal, be average height, a 25% chance that the child will be a stillborn or only live for a short amount of time, and a 50% chance that the child will have achondroplasia. Here are some pictures and examples of people with achondroplasia and explaining what it is. Alpha thalassemia, HbH, is a dominant genetic condition. This disease reduces the production of hemoglobin. This results in an insufficient amount of oxygen to cells throughout the body, and people diagnosed with alpha thalassemia will have a shortage of red blood cells, which may cause them to be anemic. This causes them to have pale skin, weakness, and fatigue. Jaundice is also another side effect of this, and some people diagnosed can have an overgrowth of the upper jaw, and their foreheads are normally prominent. This disease appears in early childhood and is genetic. People with thalassemia are expected to live into adulthood, and the geographical regions where thalassemia are more common are the Mediterranean region, India, Southeast Asia, and West Africa. And here is a Punnett square of a female carrier and a normal male. You can see right here with the two lowercase t's, that is you can see right there, that is where one of the children passed away. Osteosclerosis is another dominant genetic condition. This can cause hearing loss. This is the most common symptom of this disease, and it is caused by an abnormal growth of the bone in the middle ear. The abnormal bone adjusts the shape in the oval window, and it interferes with sound waves passing through the inner ear. This disease will show up over time. It's not detected right away, and it is genetic. People with osteosclerosis, they have a normal life expectancy, and middle-aged women, white middle-aged women, are at higher risk for this disease. If one parent has osteosclerosis, there is a 50% chance that their offspring will also have the condition.